Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
What is up, Tucson? Welcome to another episode of Vitality Vault with myself, Dr. G, and world famous, lovely Dr. B. Dr. B, how are you doing today?
I am doing very well, thank you.
Nice.
How are you doing, Dr. G?
I can't complain, and I'm really excited about the next few episodes we're going to be bringing to the public. We are dedicating them to common primary care conditions,
Yes.
things that we see on a daily basis in our own practice. And the goal of these episodes are to empower you as the patient or client to be able to ask certain questions when you go see your primary care doctor or your healthcare provider and be more informed as to where your care is going.
Yes.
So I think it's going to be a good one. We're going to keep it light to begin with and dive deeper as we go into more of these episodes into the intricacies of these conditions.
As Dr. G said, this is kind of an intro to these common conditions. Later on, because we're going to be bringing you lots of stuff in our Vitality Vault podcast. Later on, we're going to be diving deeper into certain aspects of different topics and conditions. So this is kind of give you a general feel for these topics and laying the foundation. We'll build on that later on.
Oh, yes. So let's start off with the thyroid.
The thyroid.
Oh, my gosh. I think that's one I hear a lot of people complain about. They think that their thyroid is out of whack when something is going on, whether it be weight issues, sleep issues, hormonal issues, you name it. Metabolism issues is a big one.
Right.
I know thyroid dysfunction has a huge role to play. So let's kind of break things down for them. What do you think?
Yeah, absolutely. But first of all, the thyroid gland produces thyroid hormone, which is responsible for a lot of things like Dr. G just mentioned, especially metabolism. So let's look at the different conditions that can arise when we're talking about thyroid disorders. So we have here hypothyroidism and hyperthyroidism. So as the name suggests, hypo is underactive, hyper is overactive. And typically in hypothyroidism, you've got low levels of your T3 and your T4, which are your thyroid hormones. And typically people would come in complaining of just not having enough energy. They could be possibly weight gain as well. You could have other symptoms such as thinning of your skin and hair. Some people feel really withdrawn and can have some depression and just not able to tolerate the cold as well. In hyperthyroidism, quite the opposite of that happens. You have an increase of your T3, T4 because of the overactive thyroid gland, and you can see some weight loss. Not the good type of weight loss. This is usually like really fast, unintentional weight loss, rapid heart rate or palpitations. You can have be very jittery or anxious, increased sweating, and intolerance to the heat. Typically, the diagnostic blood test would be your thyroid blood test. So TSH is usually the hallmark to tell you, because that is a biofeedback hormone when we're talking about the thyroid gland. It is actually produced in the brain in response to how much of the T3 and T4 that your thyroid is producing. So we got to remember when we're talking about TSH, it's a biofeedback hormone.
Yes.
But that tells you, that's your brain way of telling you if you're producing enough or if you're producing too much. There are some antibody testing as well, too, that you could do. TPO antibodies typically found in Hashimoto's, which is the most common cause, that is, of hypothyroidism here in the U.S. Graves is the most common form of hyperthyroidism, and you have your thyroid stimulating antibodies that you could test for as well. And just to be complete, usually you would order a thyroid ultrasound if you have abnormal thyroid function. That way you can determine if there's a nodule, if there's a cyst, a mass that we need to be concerned about, or if the thyroid is enlarged. So that way you get to know a little bit of the anatomy.
And what you can see is that with those two conditions, with the hypo and hyperthyroid, inflammation is the hallmark. Those autoantibodies are caused by inflammation, and that's what we're trying to fight against in the Vitality Vault, trying to encourage and teach people how to avoid an inflammatory lifestyle. So, but yeah, anything that's autoantibodies is inflammation, and both of those, Hashimoto's and Graves, are inflammatory disorders, and they are rampant. A lot of things that we do nowadays really bring on those antibodies.
Yes, and inflammation seems to be the hallmark of a lot of different conditions. We that's why we introduced it into this series really early, because it is unfortunately, that what most medical conditions are a cause of, increased inflammation.
Yes. So some risk factors for thyroid dysfunction. So obviously family history. And as we know, yes, if mom had thyroid issues, or grandpa or grandma, you do stand an increased risk of having those, but it's not the be-all, end-all. Once again, like we always tell our patients, you have to be the one to pull the trigger to trigger some of these conditions to manifest. Now, so having family history is important. Autoimmune conditions. So what I like to tell my patients in the clinic is, if you have one autoimmune condition, right, your risk of another one is significantly higher, because in my opinion, these things run in packs, like wolves. Yeah, I mean, there's no lone wolf autoimmune condition. If you're unlucky enough to have one and you don't get things in order with regards to your lifestyle and reduce your inflammation and cause of inflammation around you, you run the risk of having a second, and if you're unlucky, a third, and then you're taking more and more and more drugs. So just be very careful with that. So that's one thing we see. Iodine deficiency, which is not very common these days because of the foods that we eat, and we have access to iodine-rich foods. Radiation exposure, and those are typically are industry specific, depending on where you work. And your exposure, you can run the risk of knocking out that thyroid gland. And obviously pregnancy can definitely put you at risk. There is such a thing as postpartum thyroiditis, which is it's almost like an autoimmune condition that happens after the mom gives birth, and then you have the thyroid gland under attack. And you can see even during pregnancy, decreased thyroid hormone, just because of the volume expansion that the moms go through with the extra blood flow and the extra blood that they have because of the fetus they're carrying. It can make levels look lower than they really are. So it's important to when you get your blood test done, you check with your doc and make sure things are good. Now, when we're looking, like Dr. B said, TSH, that's the one we check for. Now, it's kind of a oxymoronic way of doing it, because people tend to think, oh, my TSH is high, that means I have high thyroid. No. TSH, like Dr. B said, is a feedback hormone. What that means is, if your TSH is high, then the amount of levothyroxine, T4 and T3 in your system is low. Because when the T4 and T3 are low, there's not much getting back to your brain, telling your brain, hey, we're good. I don't need any more TSH to be spit out to the thyroid to make T4. So it's kind of one of those. So the higher the TSH, the more hypothyroid you are. The lower the TSH, the more hyperthyroid you are. And of course, ultrasound to assess for any kind of goiter. And the thyroid scintigraphy is a scan that we do for patients who have hyperthyroidism to look for spots in the thyroid gland that may be overactive and knock those out.
So let's talk about treatment. And this is specifically the first couple things are prescription medications.
Yes.
So for hypothyroidism, I mean, really, we have to replace that thyroid hormone. So levothyroxine, usually it comes in the form of T4.
Yes.
This is commercially available at the pharmacy in different brand names. Levothyroxine is the generic. Now, you can also get some compounded forms of T3 and T4 where they're more extracts.
Yes.
So it's extracted from porcine or bovine, so, pork or beef extract. It's a little bit harder to get the exact amount in those compounded medications, but some people feel a little better on them. T3 is considered the active form of the thyroid hormone. T4 is actually converted to T3 in the body, so it's okay if you take just plain T4, levothyroxine, your body will convert it to T3. Of course, if you have any problems with iodine deficiency, eating more of an iodine-rich diet or adding iodized salt or concentrating stuff like seaweed that has high amounts of iodine in it would be good for you. Now, on the if you have an overactive thyroid, we need things that will calm things down. So these two medications, the most popular one, the most common ones, methimazole and propylthiouracil, we call it PPU. So they actually help to suppress the activity in the thyroid gland. If you have a really, really overactive thyroid that is causing a lot of symptoms, let's say if you've got a lot of palpitations, you've got headaches, rapid weight loss, and the medication, the two that we just mentioned, is just not going to take things down fast enough, then we could do what we call iodine ablation. You're going to really suppress those. And, technically we're killing some of the thyroid gland there, but we need to take down some of the cell activity. And in severe cases, we could do a thyroidectomy. Obviously, if we do a thyroidectomy, you would have to replace some thyroid hormones after.
For life.
Yes,
Usually
absolutely.
for life, yeah. Because once you take the thyroid,
there's partial and there's full thyroidectomy. Yes. So let's say if we did that scan that showed like a hot spot in the left side of the thyroid, we could basically take that side out. Well, the surgeon would remove that side and maybe the right side would function just enough to get you by. But most people with thyroidectomy typically end up on even a small dose of lifetime levothyroxine.
Yeah. And for most people, the thyroid gland sits in your neck. Some people don't know that. It literally sits, it's what we like to call a butterfly-shaped organ that sits right here in your neck. So you'll find if you come to see us or doctors and you're complaining of swelling, a goiter, we would palpate or feel the neck, and there's certain maneuvers we have you do and we can assess to see, okay, yes, it is enlarged, if it is, and then that can point us into the direction of further testing that we can do to figure out what's going on with your thyroid gland, or if there's a nodule. If we feel something like a solid mass, then we're going to jump on that and make sure we evaluate that ASAP.
And lifestyle changes. So common causes of thyroid dysfunction, we said inflammation caused by stress, chronic stress. So managing your stress, whether it be through meditation, through yoga, other exercises, massage, whatever you need to do to help to bring down that stress level. And there's certain there's certain nutrients such as selenium, zinc, and vitamin D in particular, when eaten, when you eat food that's rich in these nutrients, can actually help with your thyroid health overall. Yes. Well, whether it be high or low, condition that we're talking about. So concentrating on your diet, your modifying your lifestyle, that is very important for thyroid health.
Now, so we mentioned some of these before. I just wanted to jump straight to the ashwagandha and the adaptogens. Now, Dr. B, I know you're a guru when it comes to these things. So what's your take on using the ashwagandha and the adaptogens to help with balancing thyroid and maybe even other hormone health? What do you think?
So this is going back to, we're targeting that chronic stress, inflammatory condition that you have going on. Stress is a big cause of inflammation in the body. So adaptogens are these supplements, these herbs. Sometimes you can get them through foods or take them through an extract. And it helps just to manage the effect of stress on your body. Obviously, it's not going to take away any of your stress. Ashwagandha is a big one because it helps with whether it be, anxiety, depression, helps with both, helps with sleep. It's just like overall feel good supplement. We have a few more. There's like rhodiola. There's licorice as well too. There's some Chinese herbs that you can find in proprietary blend that can help to reduce the stress overall. So we're looking at stress reduction for inflammation reduction. So it's going to help not just your thyroid, but it's going to help to balance your weight and help with your sleep and everything else overall that's being affected by stress, which is technically everything in your body.
So is that why you call me ashwagandha sometimes? Because I'm that calming force in your life. Is that why? It's making sense now. I was wondering why she kept calling me ashwagandha. How are you? I'm like, I'm doing great, I guess, but that's not my name. But I'll take it.
Well, actually, you're the reason why I take ashwagandha. So I think it's
Dr. B with the zingers. Oh my gosh! In front of my producer. Wow, God, you're rough. Jeez, gosh.
Well, you didn't tell us about your socks yet today, Dr. G.
I told you it was Captain America. It's.
We didn't mention that yet.
We did. Didn't we mention it?
No, we didn't.
You know what? This is what I need some ashwagandha right now. So. This is my sock for the day. It is my Captain America sock.
Captain America.
All
right.
/ ashwagandha.
He is thyroid strong.
I am thyroid strong.
Before we leave this last slide, I just want to caution with iodine. There are a lot of supplements over the counter that you can actually get as iodine supplements. Now, in the U.S., there's really we typically don't find iodine deficiency.
No, we don't. No.
Usually it's in other developing countries where they don't have access to good food sources, etc. So there could be such a thing as taking too much iodine because we've seen that. So if you're taking iodine, you make sure that your levels are checked and, your levels are on the low or low normal side before starting and make sure you're checking with your doctor regularly on that. We don't want you to take too much iodine because that can cause some other issues in the body as well.
And with everything that we recommend and we talk about in the podcast, we want to make sure you take this information back to your primary care provider. You want to have a discussion with a qualified healthcare professional, someone you trust, someone who can actually guide you accordingly. Because, we don't want to be people just, we say and go online and begin to buy a ton of stuff. No, be smart about it. What we do is for educational purposes only and to empower you as the patient to be able to ask informed questions when you go in, especially the husbands. Because when they come in, all I hear is, I'm fine, I'm good. I'm great. And then the wives call me back. Did he tell you about this? I'm like, no, he didn't. So it's to make you better informed and to be a more, engaged patient. So hopefully this helps.
Yeah. Hopefully you guys learned something about thyroid today.
Yes.
And we will see you guys in the next
episode
of the Vitality Vault. Can't wait to get you back in here.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.